We have to first understand what makes a face young. We have to look at patterns in nature to understand that. I think a lot of times when we do brow lifting and face lifting on especially younger patients, the question is, do they need it? And do they look the same afterwards? Are they fundamentally the same person? An extreme. But it's an extreme in the idea that aging elevates, it hollows people out. And then this surgeon obviously took the brow considerably higher and more excavated than she was even in her youth. And there's a fundamental change in her identity. So what are the things that I want you to focus on today? Is it wrinkles? No. I want to talk about something quite different, which is volume and shape. And the critical element is that volume and shape can be read 20 feet away when a patient comes through my door. It's obvious. There's so much more light on the face, and that's what makes a young face young. It's a heart-shaped face or a triangle. What happens when we get older, that triangle begins to flip or invert. So do we get heavier as we get older? Absolutely. But sometimes fat, if used effectively, can slim the face down. Tom's picture of the lady with a cheek implant made her jawline look smaller. I don't know if you noticed that. But when you start volumizing the mid-face and chin, the areas that have hypertrophy begin to slim. Now, I do combine facelifting, I do combine microliposuction to get that result. But we got to look at some of our dermatologic colleagues, and they talk about the hypertrophy-atrophy model, not just gravity. We're focused as surgeons on gravity. I think we have a lot to learn from our dermatologic colleagues. So luminosity, real brightness of the face that shines. The skin looks so much better after fat, not just because of the things you may have heard about how the skin gets better, but there is more brightness, there's more light that bounces off a volumetric cheek. And there's an absence of transition zones. So what I try to do is reunite the face, take the areas that are separated and begin to reunite them, and really start to increase highlights and decrease shadows. And we talked earlier, just a moment ago, about almost the antithesis of what blepharoplasty is all about. It's about squeezing down the frame and creating a frame instead of evacuating that frame. Now, do I do blepharoplasty? Yes, but very conservative, and you'll see what I talk about. And it's almost always combined with fat grafting. This is a mother-daughter pairing. If you look at the daughter, she's got a triangle-shaped face. The mother has almost an inversion of that triangle. It flips upside down. So the goal in the restoration is to bring that youthful triangle or heart-shaped face back. So this is obviously meant to be somewhat facetious, but also meant to be serious. When you look at a young face, it's like a grape. It's full in all the right places. And over time, as you lose that volume and turgor, you become a raisin. So the question is, why fundamentally should you take that raisin, lift, pull, stretch it into a pea? Because when that pea then becomes a raisin again, what do again? You lift and pull and stretch it again. So it's constantly pulling it, and it's fundamentally changing a person's identity. So reinflation is a critical element. Is it all about this? Is it just a purist philosophy that we just have to do fat? Absolutely not. The book I wrote with Mark Glasgow is really looking at the idea of combining it with facelifts. You don't have to throw the baby out with the bathwater. It's a combined strategy. So part of what I like to do is I believe in the want over the need, but there's also an element of need because even surgeons will not focus on volume because we don't even think about it. Patients don't think about it. The media and other plastic surgeons have indoctrinated the idea that we are in a gravity world, that everything must be filtered through gravity. And oftentimes women, the way that they see themselves is in a way detrimental in a way because they look at themselves the way they put on makeup, really close to a mirror. So they're looking at fine lines and creases and wrinkles that may be, in their estimation, contributing to the aging process. But you may say, what are you talking about? I don't see it. Now, obviously, it's important to listen to your patients. It's important to listen to what their needs are and their wants are, but also take a step back and have them a bit of re-education about how to look at not lines and wrinkles, but the volume and shape contours that create youth. And once they begin to see that, I think they begin to see the world differently. So this is just some of the reiteration that you heard before. The implants, as you get older, they can be problematic. And part of the reason is that when you just put an implant in, you can sometimes see the implant, as Tom was mentioning, and it can exacerbate transition zones. And I'm going to show you more fundamentally with a photograph, and I think it'll be clear. The anterior cheek is a fundamental element where it just allows you to create a very nice rejuvenation to the face, where the lower eyelid looks so fresh and rejuvenated just by putting some volume into the cheek. It makes you look less tired, and that's an area that is so critical. What Jim was mentioning, Jim English's consistency, reproducibility, and excellence you can do with this. What it would take someone significantly more time with a mid-facelift, I can do a consistent anterior cheek fill with fat very easily. So again, this is just the re-education and thinking about looking at your face with no flash, no bright illumination, no magnification, but sitting at a social distance from the mirror and judging the face at how you would interact with another human being. All my photography is done with no flash photography because basically that's how we see each other, is sitting in a room with just overhead lights or outside with just overhead lights. Very rarely will there be in-your-face light. So bring in old photographs to try to understand the patient's identity. The principle is not to overcorrect, so you avoid those complications. Start small and consistent. Here's the thing that people have been distraught about in the past. The thing that people have been using fat for is lips and lines. And those two areas fail consistently. Now you can get good results, don't get me wrong. You can go up there and show me some great lips and line results. But it's consistently harder to achieve. So if you look at my before and afters, you won't see much change in the lips and lines unless I did something else. It's more for volume contouring. So if you understand that at a fundamental level, you understand the benefits of fat. So the complementary idea is that we don't have to give up everything. We can use this in combination and accentuate your facelift results, accentuate your blepharoplasty results. What we did in this book, Complementary Fat Grafting, is make it easy. Take some of the artistry level out and break it down into three fundamental levels. An empirical volumetric foundation, which makes it just give you the volumes, give you the how to do it, and then build on that into a refinements phase, and then after about a year, adding maybe some of the advanced concepts that may be higher morbidity in a novice's hands. So this is just an illustration from the book. It just talks about what volumes, where to put them, and how to do it. And this is the refinements phase, and then advanced. There's no bandages, there's no sutures, there's nothing. There's nothing to do, just some ice. So it makes it extremely easy. The only thing I ask my patient is to cut down dietary salt and not to do a lot of excessive bending over of Valsalva. And pretty much they can even exercise the areas I've harvested from. I just ask them not to do a lot of stomach crunches or increase Valsalva. So let's talk about some fundamental aspects of sort of conceptualizing this. Inverting the triangle, flipping that triangle back up. This is a lady that looks almost heavy on the left, but she looks slimmer on the right. So I did take a little skin from her upper eyelid, and this actually brings you back to the concept I brought about yesterday, which is maintaining crease position. I've actually pushed the crease lower. But this is slimming that face and bringing out the triangle and flipping the triangle back to where it should be. Another example, you can see that nice triangularity there, and actually the jawline looks slimmer with no facelift for a 55-year-old. And that no blepharoplasty was performed here, just filling in around the eyes that create a beautiful change. And again, really no change in the lines. I did a little silicone in the lips, so if you see a little accentuation there, that's silicone that is not fat. Eliminating transitions, very important. This gentleman looks feminized, overlifted brow, scar, did a geometric broken line to fix that in the forehead. But if you look at the facial features, there's a blending of all the areas. The bone of the cheek has been eliminated, and even the jowl has been eliminated through fat. There was no brow lifting or any other cutting here. This is a lady that had a facelift, cheek implant, chin implant done elsewhere. And if you see, my fat into the jawline looks better than the facelift. And her cheek implant has actually accentuated the transitions between her above her cheek and below her cheek. So really what the fat has done is create beautiful luminosity and really soften the transition zones. Framing the eye. Let's talk about that again. If you look here, you may interpret that as needing a brow lift or upper eyelid procedure. That's just adding fat. What I want you to focus on is that linear depression where you see that bone. Filling that in, if you look at one thing interesting, I've pushed that eyelid crease down. All the results you're seeing before is pushing creases up. But if you look at a young woman, they have low creases. So pushing that down and creating luminosity in that brow is beautiful. I did transconj bleph and I combine it with a cheek, lower eyelid fat graft. And you can see that that brings the sparkle and volume and luminosity back out. This lady had a brow lift upper lower eyelid. Obviously you say, well, I don't do these kind of things, really too aggressive. And you can see volumizing that, at least getting it back closer to where she wanted to be. I think I've helped at least get back some of her identity. And after 14 months, you can actually start seeing that transition of the skin start smoothing out, which is no skin treatments, no peels, nothing else. To me, that's pretty exciting. And again, look at that skin because there's luminosity. No facelift here actually. The jawline looks better with fat. And you can see 15 months out a really beautiful transition zone. Or I've actually taken, if you think about what I've done with that upper eyelid, I've pushed that eyelid all the way down over the eye. It's the opposite of what you've heard for the last 2 days. I filled and framed that eye. So using old photographs, do I get people closer to their old photographs? The question is, do you? And if you see here, this is a lady that had a brow lift on the left. I did a facelift and I did volume. And you can see